only about 30% of the nation fully vaccinated, health officials are reporting demand for doses is actually dropping. Our Barrett Leone is in the studio after investigating if this slowdown is happening locally and why. Barrett.
Well, Tom, we are seeing a dramatic change from just about a month ago. And we have more vaccines, but not as much demand. From January to April, the slow in demand is visible.
We have some open slots. Earlier, people were really anxious to get in and get vaccinations, and we had a much higher demand than the supply, and it seems to be shifting.
At Mayo Clinic, that stall has been happening within the last 10 days. In the last week, doctors say 89% of appointments in Rochester were filled, and 93% were filled in Southeast Minnesota clinics.
We have more vaccine availability than demand for it.
The CDC says 8% of Americans who got their first dose of the vaccine won't get their second dose. There isn't data to support that this is happening in Southeast Minnesota, but the messages from health experts stay the same.
There is no reason why people should not get the vaccine. There is absolutely no reason at this time for anyone to not get the vaccine.
Other hospitals are feeling the lag as well.
Right now, everybody is kind of sitting pretty flush with vaccine.
Winona Hospital has more than half of its allotted doses left over from last week.
We all knew the day would come when there would be way more than enough vaccine, and here we are. So that's a good thing.
And in Iowa, more than a quarter of the state's vaccine doses from the federal government were denied for lack of demand.
But we still have lots of people to vaccinate yet.
We're all in this together, so it's really a community perspective that we need to take as far as this vaccine goes.
Mayo Clinic is launching a campaign called Get the Vaccine to Save Lives. They're partnering with Cleveland Clinic and about 60 other clinics around the world to inform Americans about the safety and effectiveness of vaccines and ultimately encourage folks to roll up their sleeves and get the shot.